Good morning, interns. This is a discussion on chemical examination of urine. For this part of your analysis, we utilize the reagent strip, for this provides a simple yet rapid means for performing medically significant chemical analysis of urine. There are two major reagent strips of the brand named Multi-6 and ChemStrip. These consist of chemical impregnated absorbent pads, which are attached to a plastic strip. Having good reagent strip technique is one practice that every medical technologist should have. So first, you should dip the reagent strip briefly into a well-mixed, uncentrifuged urine specimen at room temperature. Secondly, you should remove excess urine by touching the edge of the strip to the container as the strip is withdrawn. Third, blot the edge of the strip on a disposable absorbent pad. Fourth is that you should wait for the specified amount of time for the reaction to occur. Lastly, you should compare the color reaction of the strip pads to the manufacturer's color chart in good lighting. Take note for important parts is to avoid run over by blotting the edge of the strip on the absorbent pad while holding the strip horizontally and comparing it with the color chart. The manufacturer's stated time should be followed, and if not, manufacturer's recommended reading time should be between 60 to 120 seconds. Next, we will discuss the errors caused by improper technique. Firstly, are the formed elements, such as RBCs and WBCs, which sink, and they will not be detected in an unmixed specimen. This can be corrected by mixing the specimen first or by swirling before using it for reagent strip testing. Secondly, is allowing the strip to remain in the urine for an extended period, which may cause leaching of reagents from the pads. Third is the distortion of colors caused by runover between chemicals on adjacent pads. This can be corrected by blotting the reagent pad on absorbent paper after withdrawing it from the urine specimen. Fourth is the timing for reactions to take place, which vary between tests and manufacturers, and the ranges from an immediate reaction for pH to 120 seconds for leukocyte esterase. And lastly, a good light source is essential for accurate interpretation of color reactions. Next, for the handling and storing of reagent strips. We should store it with desiccant in an opaque and tightly closed container, and it should be stored below 30 degrees Celsius, and it should not be frozen. We should not expose it to volatile fumes, and it should not be used past the expiration date. It should also not be used if the chemical pads have become discolored, and we should always remove strips immediately prior to use. For the quality control of reagent strips, it should be checked with positive and negative controls once every 24 hours. It should also be checked when a new bottle is opened and questionable results are obtained, or when there is a concern about the integrity of the strips. Distilled water is not a recommended negative control for reagent strips, and you should always record all control results and reagent lot numbers. For confirmatory testing, using of different reagents or methodologies to detect the same substance as detected by the reagent strips with the same or greater sensitivity or specificity. Next are the reagent strip parameters. For a 4-parameter reagent strip, it should consist of pH, specific gravity, glucose, and protein. On the other hand, a 10-parameter reagent strip should cover pH, specific gravity, glucose, protein, ketones, blood, bilirubin, urobilinogen, nitrite, and leukocyte esterase. An 11th parameter can also be added for ascorbic acid, for a 12th parameter for creatinine, and a 13th parameter that can be used for microalbumin. So the first parameter that we will discuss for reagent strip is the pH. The principle behind this parameter is the double indicator system. The reagents that are present on the absorbent pad are methyl red and bromthymol blue. The sensitivity for multisticks is 5 to 8.5, while for ChemStrip, it's 5.0 to 9.0. The sources of error that can be found are run over from adjacent pads or from old specimens. pH is usually correlated with nitrite and leukocytes. The next parameter would be specific gravity. The principle behind this is a pKa change in the polyelectrolyte, and the reagents that are present in the multi-sticks pad is polybromthymol blue, and for ChemStrip, it's ethylene glycol, diaminoethyl, ether tetraacetic acid, and bromthymol blue. The sensitivity for both is 1.000 to 1.030. The sources of error that can cause a false positive result would be high concentrations of protein, and for a false negative result to appear would be a highly alkaline urine with a pH of greater than 6.5. The next parameter is glucose, and the principle behind this parameter is the double sequential enzyme reaction, which for the reagents under multisticks are glucose oxidase, peroxidase, and potassium iodide, while for ChemStrip, it's glucose oxidase, peroxidase, and tetramethylbenzidine. The sensitivity for multisticks is usually a measurement of glucose of 75 to 125 milligrams per deciliter, and for ChemStrip, it's 40 mg per dl. The sources of error that can cause a false positive result would be contamination by oxidizing agents and detergents, and for a false negative result, it's usually high levels of ascorbic acid, high levels of ketones, high specific gravity, low temperatures, or improperly preserved specimens. Glucose correlations can be used with ketones and proteins. The next reagent strip parameter that we will be discussing is protein. The principle behind this is the protein error of indicators. The reagent under multisticks is tetrabromophenols blue, while for ChemStrip, it's 3', 3", 5', 5" tetrachlorophenol, and 3, 4, 5, 6 tetrabromsulfophthalein. The sensitivity for multisticks is 13 to 15 mg per dl of detected albumin, and for ChemStrip, it's 6 mg per dl of albumin. The sources of error that could cause a false positive reaction would be a highly buffered interference of alkaline urine, a pigmented specimen like phenazopyridine and quaternary ammonium compounds, antiseptics, chlorhexidine, loss of buffer from prolonged strip exposure to specimen, and a high specific gravity. False negative results for this parameter would be proteins other than albumin and microalbuminuria. Correlations that are important with protein would be blood, nitrite, and leukocytes. For the next parameter, it would be ketones. The principle behind this parameter is a sodium nitroprusside reaction. The reagents under multisticks is sodium nitroprusside, while for ChemStrip, it's sodium nitroprusside with added glycine. The sensitivity for multisticks is 5 to 10 mg per dl of acetoacetic acid detected, and in ChemStrip, it's 9 mg per dl of acetoacetic acid or 70 mg per dl of acetone detected. Sources of error that can cause a false positive reaction would be phthalate dyes, highly pigmented red urine, levodopa, medications containing free sulfhydryl groups. And for a false negative result to appear would be improperly preserved specimen. And for correlations, ketones is usually correlated with glucose. Next is the parameter for blood. This has a principle of a pseudoperoxidase activity of hemoglobin, and the reagents for multisticks is diisopropylbenzene, dihydroperoxide, and 3, 5, 5' tetramethylbenzidine, while for ChemStrip, it's dimethyl dihydroperoxyhexane and tetramethylbenzidine. The sensitivity for multisticks is 5 to 20 RBCs per ml or 0.015 to 0.062 mg per dl of hemoglobin, while for chemstrip, it's 5 RBCs per ml and hemoglobin corresponding to 10 RBCs per ml. The sources of error that could cause a false positive reaction would be strong oxidizing agents, bacterial peroxidases, and menstrual contamination. For a false negative, it could be high specific gravity or crenated cells, formalin, captopril, high concentrations of nitrite, ascorbic acid of greater than 25 mg per dl, and unmixed specimens. Correlations for blood is usually with proteins. For bilirubin, this parameter has a principle of the diazo reaction. The reagents for multisticks is 2,4-dichloroaniline diazonium salt, while for chemstrip, it's 2,6-dichlorobenzene diazonium salt. The sensitivity for multisticks is 0.4 to 0.8 mg per dl, while for chemstrip, it's 0.5 mg per dl. The sources of error that can cause a false positive would be a highly pigmented urine, phenazopyridine, indican, and metabolites of lodin. For a false negative, specimens that have been exposed to light or ascorbic acid of greater than 25 mg per dl and a high concentration of nitrite. Correlations would usually be with urobilinogen. Next, for urobilinogen, the principle under multisticks is the Ehrlich's reaction, while for chemstrip is the diazo reaction. And for the reagent under multisticks, it's p-dimethyl aminobenzaldehyde, while for chemstrip, it's 4-methoxybenzene diazonium tetrafluoroborate. The sensitivity for multisticks is 0.2 mg per dl, while for chemstrip, it's 0.4 mg per dl. Multisticks false positive can be because of porphobilinogen, indican, p-aminosalicylic acid, sulfonamides, methyl dopa, procaine, chlorpromazine, and a highly pigmented urine. For multisticks false negative source of error could be because of old specimens and preservation with formalin. For false positive under chemstrip, a source of error could be highly pigmented urine, while for the false negative could be old specimens, preservation in formalin, and high concentrations of nitrite. Correlations with urobilinogen is also with bilirubin. Next parameter would be nitrite, and the principle behind this parameter is the Greiss reaction. The reagents for multisticks is p-arsenilic acid tetrahydrobenzoquinolone 3-ol, and for chemstrip, it's sulfanilamide hydroxy tetrahydrobenzoquinolone. For the sensitivity of multisticks is 0.06 to 0.1 mg per dl of nitrite ion, and for chemstrip, it's 0.05 mg per dl. The sources of error that could cause a false positive would be improperly preserved specimens and a highly pigmented urine. For the false negatives, could be non-reductase containing bacteria, insufficient contact time between the bacteria and urinary nitrate, and it could also be a lack of urinary nitrate and a large quantity of bacteria converting nitrite to nitrogen. It could also be the presence of antibiotics and high concentrations of ascorbic acid and also high specific gravity. Correlations with nitrite are usually with protein and leukocytes. Next, for the parameters of leukocytes, the principle behind this is the leukocyte esterase. The reagents that are carried under multisticks is a derivatized pyrrole amino ester and a diazonium salt, and for chemstrip, it's indoxyl carbonic acid ester and diazonium salt. The sensitivity for multisticks is 5 to 15 WBCs per HPF, and for chemstrip, it's 10 to 25 WBCs per HPF. The sources of error that could cause a false positive would be strong oxidizing agents, formalin, highly pigmented urine, and nitrofurantoin. The sources of error that could cause a false negative would be high concentrations of protein, glucose, oxalic acid, ascorbic acid, gentamicin, cephalosporins, tetracyclines, and inaccurate timing. Correlations for leukocytes would be protein and nitrite. Next is for the testing of microalbuminuria. This is significant when there is 30 to 300 milligrams of albumin that is excreted in a 24-hour urine specimen. Next, for the micro test, the principle behind this is enzyme immunoassay, and their agents are gold-labeled anti-human albumin, beta-galactosidase, and chlorophenol red galactoside. A false negative could be because of dilute urine. Next, for immunodip, the principle behind this is immunochromographics. Reagents, which are blue latex particles coated with anti-human albumin antibody, and false negatives could also be because of dilute urine. For the interpretation of immunodip, the top band is the bound particles, the bottom band are unbound particles, while the darker bottom band would signify a less than 1.2 mg per dl, which is interpreted as negative. Equal bands would be 1.2 to 1.8 mg per dl, which is interpreted as a borderline, while the darker top band would be 2.0 to 8.0 mg per dl, which is interpreted as positive. Thank you for listening, and I hope you learned a lot from this discussion.